Hello, I'm Dr. Dev Patel, and hopefully you watched part one on me trying to bring some clarity to the information around self-isolation. This is just now bringing in a little bit more of the current data we have and evidence, and I saw a fantastic chart sent to me by a medical colleague a few weeks ago, which was based on some of the publications from Lara et al. In Annals of Internal Medicine, Ferguson et al. From the Imperial College COVID response team, and a publication in The Lancet by Yang Liu and his colleagues on the virus and its replication. And this chart is, falls slightly outwith of the simple government chart that I showed in part one, and I'd still urge people to essentially follow this. But I did say that, let's bring in some of the current data and let's look at this chart. I found it very interesting, and what I'm showing is essentially what this chart was showing. So let's start with the whole population. They're going to fall into four groups. There is around 30% of people are going to have no symptoms. 55% mild, moderate, 10% severe, and then 5% critical. And I'm going to do a timeline here. So if we do 0, 5, 10, 15, 20, 25 just. I mentioned in the other one, excuse the improvised whiteboard, this is clearly a frame, but it works for what I wanted to show you. And so this is our timeline. So this is when the virus hits, okay? This is when the virus infects the body. And looking at our key here, need the green pen, whether you're going to be in the symptomless group, the asymptomatic group, or the symptom group, they showed that there's approximately 5-day incubation period. So the green box is not showing incubation period alone, because obviously for this group, it's you're not going to know because they're not going to get any symptoms. So this is really the no symptom period, okay, for everyone, about 5 days. Now this group here, that they're not getting symptoms anyway. So what we're now going to show along here is that they've got assumed immunity. Okay. Now we know that this isn't necessarily true, and there are some people also who get reinfection and get symptoms 5 or 7 days later. Just because I've mentioned that, obviously if that happens, people should be self-isolating again. You've got to take caution with this. But that's what we're going to be showing here. And the mild and moderate group, where are we? Yeah, and then symptoms. So then they get symptoms. So, excuse me, I'm getting my colours mixed up. So this is a group that's going to develop symptoms. And what they showed is roughly about to day 11, they would have symptoms. And for this group, it extended to about day 20. And for this group, about day 21. So we'll just go a little bit beyond that and that. Okay, excuse the artwork. And during this period, this is the group that are going to be in hospital. Okay, so this is hospitalization. And this is a group that are going to be in ITU, maybe get ventilated. Now, as you can see, the symptom period varies. Now, if you're following the government advice of 7 days of self-isolation, then this would fit within that. And even here, remember the advice is that if you've still got symptoms, you have to continue self-isolation. So again, you'd be fine because you're going to be isolating for, clearly if you're in hospital, you're being isolated as best as you can anyway. But really we're talking about this group here. However, this is what we need to look at. How long are you actually contagious for? And this was what was interesting, was that actually even in this group, the symptomless group, they're potentially contagious for 14 days, which is fine, fits within the government guidelines, correct? These three groups are the interesting groups. This one was shown to be contagious potentially for up to 21 days from when the virus hit. And these groups for up to 25 days. So what we can see here is that, and I should put in the immunity thing as well, is that there's an overlap between period of presumed immunity and period of when you're still contagious to others. And of course, immunity is less important. We need to think about spread. It's the spread is the key thing here. So if we follow the government rules, the 14-day rule, which I must stress, it's important for you to follow this. And this isn't trying to scare people, it's just being aware of the current data shows that actually the majority group, which is the 55% group, is actually the most deadly to other human beings. Because this group, without symptoms, they are deadly in the fact that they don't know they're spreading it. So they may not know that they need to be self-isolating unless there's someone with symptoms in the household. So they're deadly. But actually, if someone without symptoms is self-isolating 14 days, they're going to be about right. This group are in hospital. So sadly, that's not true self-isolation, and they're risking spreading it to medical workers, and we know that's happening. But they're still being treated as positive patients, and actually, in a way, that's better in terms of spread. But this group, the 55% with the mild to moderate symptoms that are able to stay at home, they are potentially contagious for 5, 7, or even 10 days beyond when their symptoms are going to finish. Remember, the symptoms finish here, and yet they continue to be contagious for up to 21 days following when they first got infected from the virus. And so this is why the stay-at-home rule is so important, and why even people who are going out repeatedly to the shop saying, oh, I'm fine, or I've done this and I've followed the rules. This is why with every video I've done on the coronavirus, I've still kept harping on about the stay at home and the fact that yes, social distancing is good and you know, some of the rules that have been implemented, but nothing beats self-isolation and staying at home. Even if you've followed the rules, you might still be infecting others. Now imagine what one person can do in 7 days when they think they're absolutely fine, they're not doing any harm to anyone. It almost makes you a bit complacent in your behaviour, I think, in many cases. I'm also seeing a lot of people popping out of their houses almost every day to get 1 or 2 items from the shops. This shouldn't be happening. You should be trying to be a bit more organised. Or, you know, if you have to make do without bread for a couple of days or without milk for a couple of days, then so be it. You know, you've got to try and plan. This is about planning. And, you know, imagine you live in the middle of nowhere and you make a weekly or monthly visit to the nearest town to do some shopping. That's how you need to behave. Because even if you follow the rules, you are still contagious for a lot longer than you think you might be. Okay, hope you enjoyed this video. welcome any messages or any questions, and I'll try and address them for you. Of course, this advice is going to be adapted and change as we learn more about the coronavirus and this particular strain. But until then, this is all we have to go on. Thanks very much.